When dealing with lateral knee pain, it can be a few different causes, and some of those causes could be an LCL tear, it could be some arthritic stuff, but more commonly it's going to be some meniscus tears, lateral meniscus tear, or ITBS or IT band syndrome. All right, so what's this IT band all about? Well, it's going to be this connective tissue. It's very fibrous, and it's going to run from the hip, so where the TFL and the glute is, it's going to kind of connect to those, and it's going to shoot down your leg and go past your knee joint, and it's going to connect to the lateral condyle of your tibia. Well, when it passes that knee, it's going to act as a stabilizer, and it's really good for running, and there's a lot of reactive forces to it. So it's most active when we're running. Well, when we do use our knee and we do flexion and extension of the knee, it's going to create a ton of friction where that IT band rests alongside of the quad, and all that tension and friction is going to create adhesion, and that tightness starts to translate into knee pain. And that's because when that band gets tight and our knee flexes about 30 degrees, that band's going to rub against the lateral condyle of your femur, and that bump, that protrusion, so it's going to constantly go back and forth, create irritation, and that's where that knee pain starts to pop up. Next, I'm going to show you a test that you can actually do yourself to see if you have ITBS. If you stand next to a wall, you can use that wall for support in case at any point you need it. But otherwise, what we're going to do is we're going to stand on one leg, and we're going to see if the hip drops out or shoots out like that. If it doesn't, then we're good. But if it does, it's a pretty clear sign that we have dysfunction in the hip, probably contributing to that ITBS. Otherwise, what we're going to do is use the wall for support if you need to, and we're going to bend our knee about 30 degrees and keep our weight centered, try to make sure the hip doesn't drop out or anything like that. If you have knee pain in that position, that is a fail on that test, then there is a good chance that you do have ITBS. Dealing with IT band syndrome, we can safely assume we have a weakness in the glute, and so with that being said, we probably have an overactive muscle, which is the vastus lateralis, or the side of the quad. The IT band butts up right against that, and then the fascia kind of covers that quad, that tissue. So that adhesion that starts to create there from friction, we're going to want to break that up. So we have a foam roller here, and so what she's going to do is she's going to use that foam roller, apply pressure, using this foot to kind of relieve some of the pressure, since it's going to be pretty painful to just completely lay on it. So use that for some support, and then she's going to roll up and down until she finds a spot of tenderness. When she finds that spot, she's going to go slightly below that distally, pin it, and then she's going to flex her knee and then do knee extension. She'll do that about 5 to 10 times per spot, and then when she's done with that, she's going to roll a little bit further down, find another spot, and when she does that, she's going to do the same thing, rinse and repeat, anywhere from 3 to 5 minutes per leg if it's on both sides. Otherwise, that injured leg, try that for about 3 to 5 minutes. So if part of the problem from the IT band is a weak glute, it could be coming from a tight hip flexor because we don't have glute extension or hip extension because of the tight TFL. We're going to want to break that up too, so I'm going to show you how to do that. I have a lacrosse ball, you could use a tennis ball or whatever you got, and you're going to find this kind of like pocket where your hip is, and right below this bump on your hip, you're going to go into this kind of tissue, and then you're going to use that ball to kind of break that up. So she's going to lay on her side, and she's going to do kind of the same thing, using the one leg for support so her body's not into it. This bottom leg, you can extend it out or bring it in a little bit, whatever you can do to get that ball comfortably in that little pocket. And then when she has it there, you'll probably feel it right away. So just sit and breathe through it. You want to be comfortable enough where you can breathe and let the muscle relax. If it hurts too much and we have too much pressure on it, it won't be able to relax. So that's kind of the goal here. So find that spot, breathe, relax, and hold it for about 30 seconds. All right, so we went and we released the TFL. We also broke up all the fascia where the TFL is and sits right alongside the vastus lateralis or the quad. So now that's all released and inhibited, we can lengthen it. So this is a hard area to stretch, or the IT band is really tough to stretch because it is so tight and it's really adhesive. It's really hard to move this thing. So we're going to try a couple of them. The first one I'm going to show you is the supine figure 4. So she's going to bring her leg up on her other leg, and she's going to kind of swoop through and grab her leg and pull it towards her. And as she's doing this, she should already feel a stretch. And you can get a deeper stretch is by pushing her elbow into her leg towards me and kind of create a little bit more rotation here and get a deeper stretch. Breathe, let it relax, and hold that for 30 to 60 seconds. And this will be my first variation. It's one of my favorite stretches for the hip. The next variation of the IT band stretch is a standing version. she's going to take the leg she wants to stretch out and put it behind her, and then she's going to have both feet flat on the floor. Then she's going to reach towards the foot of the leg that she's actually trying to stretch out, and same thing, she's going to hold that position for 30 to 60 seconds. Okay. All right, so we just finished up with our 2 IT band specific stretches. We also want to incorporate a TFL stretch. Since that TFL does feed directly into the IT band, we're going to want to make sure that we stretch that overactive muscle out as well. So I'm going to go ahead and link a video to that. Once we get through all that increased mobility and break up all the fascia and we don't have any pain, we can go ahead through our strengthening portion of the program, and that would come in the form of hip abduction, or bringing the leg away from our body. So like the sideline leg lift would be a really good example of that. So I'm going to link to a video for that for the sake of time. Once you get through all that, after 4 to 6 weeks, you should be in a pretty good spot. If you go back into the program that you were in and you're a runner, I would definitely consider reducing your mileage up to 50% and then easing your way back into it. And if you have any choice in the matter, definitely choose to do level surfaces and soft surfaces. So anything hilly or up or down hills, I would avoid for now, at least starting back into your program. So hopefully this helps, and I appreciate you watching the video, and definitely check back for more.